Yeah. I'd like to call the meeting to order, and I'd like to welcome you to the meeting today. Thanks for coming. Appreciate your efforts. And we will approve the agenda first as provided to you. However, before we do that, I'd like to ask who's here today that's going to want to speak at the end of the meeting. So we got just Tim, and you're already on the agenda as president. Yep, correct. Anybody else? Okay, so we'll approve the agenda.
I'll make a motion to approve the agenda.
And I'll second. All those in favor indicate by saying aye.
Aye.
Aye. Motion carried. Minutes of the meeting previous, February 14th, are provided for us. I'll accept the motion, or
I'll make a motion to approve the minutes.
motion is made. I second it. All those in favor say aye.
Aye.
Aye. Motion carried. We will have a public hearing on the budget amendment for fiscal 22-23. A motion to open the public hearing.
I'll make said motion.
I'll second. All those in favor say aye.
Aye.
Motion carried. Are there any written or verbal comments? Verbal from the group today or written?
I have no written.
Okay, thank you, Kelly. We have a motion to close the public hearing.
Make the motion.
And second it. All those in favor say aye.
Aye.
Aye. Motion carried. And now we have the resolution for the budget amendment. And that is in our packet. Are there any questions or discussions for that resolution? And I would like to just make this comment, and Kelly already knows this, but just so it's communicated. I think Darren and I are both getting into this and a little bit new to this process. We would like to see a little bit more of the evidence for these changes in the future. And we'd also, my reaction to this from a standpoint of the different departments and the amounts that they're requesting here is that it's a little bit significant. So in the future, I would like to see us be able to keep budgets and plan ahead a little bit than to get into situations like this. But I realize things happen. So it's not like things don't happen and you can't do this. You can do this. But certainly we want to be respectful of the idea of being conservative when it comes to the taxpayers' money. So in the future, we'll work on that, both in terms of trying to work with the departments and also trying to get more information on what's going on. So with that, if there's any other discussion, we will entertain a motion to approve the resolution.
I'll make a motion to approve the
And
resolution.
on a second, all those in favor indicate by saying aye. Aye. Aye, and the motion has carried. And the fourth item on the agenda is the resolution for the lease purchase agreement with US Bank Corp. Not to exceed 600,000. And that information is provided for us in the packet. Any discussion or questions on that?
This is for the property.
It's for the dump trucks.
That's what it's.
Yeah.
Yeah. And
Did we have the agreement on that, Jeff?
We do have a purchase order on that. This is just to fill out the rest of our paperwork.
Yeah.
To continue on
yes,
with the actually putting them under a lease purchase agreement with US Bank.
And the total is 576,147.
Yes. But I think we did a lease purchase not to exceed 6,000 just to.
sure.
So you came in under.
Yes.
Yeah.
They always add on a few more extra dollars.
I'll make a motion to approve the purchase.
Okay, I second the motion. We have a motion and a second. All those in favor of the motion indicate by saying aye.
Aye.
Aye. Motion is carried. Number 5 is approval of Iowa DOT funding agreement for the Bridge 51 on Risky Ridge.
This is a standard agreement between Waco County and the Iowa DOT to use our HBP funding, our highway bridge funding, for the replacement of this bridge.
And The amount that we're getting from them is, did I see 500,000?
That was the estimated amount at the time of, when we actually let it.
Okay,
The actual price came in closer to 900,000.
okay,
But they pay for everything that is. They're able to pay for.
okay.
Everything.
So they pay for the 900,000, not the
Yeah.
500.
Correct.
Okay,
So we will use the HBP funds to pay for that
Okay.
bridge, and it will not come out of Whirlpool.
yes,
It will come out of our local pay or our local budget, but then the state comes back and then reimburses the county for that expenditure.
yes, okay. Any other questions or discussion?
I'll make a motion.
Okay. Motion is made. I'll second. All those in favor of the motion indicate by saying aye.
Aye.
Aye, and the motion is carried. We are now at number 6. It's the New York Life Insurance presentation. And can you tell us how much time you're going to take?
3 minutes.
You can have a little longer than that.
Okay.
Thank you.
I'll take. It's for you. I'll be pass that along to Brian. So neither of you were here last fall when I started. I gained a client that had formerly worked for the county, and when I saw the benefits that this individual had, the way it was put together was like nothing I'd ever seen. It was upside down. So in my line of work, there is term coverage, and everybody understands you want to outlive your term coverage. You know, we expect you to live a long and healthy life. And sometimes an insurer will tie on to that term coverage accidental death and dismemberment, or what we call AD&D. And the way the current policy is structured, or the way most of those are structured, is you have an equal amount of AD&D to the term coverage that you have. Well, what I see in the county's coverage is you have $37,000 of AD&D for every employee and only $20,000 of term coverage, which is not, I don't know how anybody wrote that, honestly. It's just completely upside down to the way we normally think about those things. If anything, the term coverage should be greater than the AD&D. Fewer than 6% of term policies will ever pay, and fewer than 10% of those single digit policies that do pay will pay for accidental death or dismemberment. So the dismemberment means whatever percentage of your body is not functioning any longer, that percentage of your policy is paid out. If you die in an accident, then the AD&D coverage is added to the term coverage that you have. So if any employee of the county were to die in an accident, at this point, they would get $57,000 of coverage. Any employee dying of a disease or some other reason other than an accident only gets $20,000 in coverage. I missed last week's meeting because I was sitting by my dad's bedside. He passed about 11:30 on Valentine's Day morning. And our total expenses so far are adding up somewhere, just for the memorial service, somewhere around $18,000. And we haven't even started to touch expenses for the estate, so on and so forth. So it seems to me this policy was written a long time ago. I'm not sure the reasoning behind it, and it seems a little undervalued for the employees. So the last page of what I handed to you has two proposals. The first one that I have the easiest time really believing in is that I'm offering to up the term coverage for every employee to $50,000. And then there would be matching $50,000 of accidental death and dismemberment. The cost of that policy would be a little over $1,000 a month. It's like $1,040. County currently pays about 700 and I want to say $740 to $780 a month in coverage. Less than 5% of that is for spousal coverage or for children. The majority of it is just primarily for the employee. So the obvious question, let me stop there. Any questions about what I've said this far?
Yes, the coverage we do have, that's not with you?
It is not. No, it's a company in Texas.
Okay. Did you state your name and your?
Yeah, I'm sorry. I'm Paul Katzian.
Okay.
I know you pretty well, Brian. I think I met with most everybody in the room because the county does have employee whole life coverage. And so during enrollment a year ago, met with every county employee. Obviously, the two of you weren't here at the time.
Okay.
But
And you have a local office, is that correct?
well,
You operate local.
I do operate locally, yes.
Okay. Right.
Yeah, absolutely. And you'll notice that the name on the front of this coverage is not New York Life. While my agency is primarily with New York Life, I am free to write for companies outside, and Standard was the highest rated company with the best premium for this kind of a group. And that's why you have the Standard on there. So the obvious question is, if we're going to spend 56% or 59% more premium, I do want you to know that for that 59% increase in premium, you get 150% more benefit per employee. I think that's a good exchange of values, but so what do you get for that? You have a list of value additions that I'll read for the benefit of everybody else here. This aligns better with industry standards between term and accidental death and dismemberment. Secondly, additional coverage will be offered to every employee as part of this plan at their own expense. The answer I hear the most when I call somebody like Kelly and say, hey, could we get together and talk about your insurance coverage, is I already have it at work. I have coverage at work. Well, quite honestly, if you're a primary wage earner, and there's some in this room, for your family, and all you really have at work is $20,000 of guaranteed term coverage, unless you die in an accident, and then it's $57,000. That's not enough. If you're a primary wage earner with dependents and a mortgage, better be significantly more than that. And the fact that these term policies inside the employee environment are offered without any underwriting up to $300,000, and that all is detailed in the packet that you have. Up to $300,000 of coverage now becomes a more significant, a more realistic amount of coverage for some of the professionals that are represented in this room. And they're able to purchase that much cheaper than if they came to me outside of the county and sought for that kind of coverage. So additional coverage offered at employee's expense. Portability. Upon separation from employment, the amount of coverage in force moves with the employee at that rate. Now, these are what we call banded rates. So at age 65, your rate goes up. At age 70, your rate goes up. At age 74, it goes up. And that would be the same for the employee, for the former employee as they move out. So I wouldn't want anybody to feel like there was a bait and switch there. If you were retired at 64, find out a year later your premiums went up, they were going to go up anyway. So it's a banded coverage, but to me the big headline is you do not have to underwrite for this coverage. They just you have it as part of being an employee, and when you move, the coverage goes with you, the premium stays the same. Any questions that far? Okay. Further value additions, waiver of premium if the employee is disabled for any reason. So it's not just if the employee is disabled at work. If you are cutting down trees on your property and become disabled, the waiver of premium built into this policy looks at a 6-month view, and if you are off, you keep paying the premiums for 6 months, and upon day 1 of month 7, they begin picking up the premium and go back and reimburse you for the previous 6 months. So that's how waiver of premium works for those. Convertibility to permanent coverage. So if you are getting, closer to, I'll be 57 in a few weeks here, getting closer to my age, and now I'm thinking about how I might outlive my term coverage, I can come back to the standard with any amount of my term coverage, and they will convert it to permanent coverage that I can never outlive. So they have convertibility. And then I'll break my arm, pat my own back. Enrollment by an insurance professional. The thing that you get with this policy from standard, at whichever rate you choose, is me. I'm on the clock. Folks here in this room know that I'll be there in the office, kind of doing the yeoman's work of getting people enrolled, making sure they get their questions answered about how much coverage they can purchase, how much it's going to cost, what it does for them in the future, so that we're not pushing this off on Kelly's office as more work for them to do, or any other supervisors in the different departments around the county. Enrollment is something that I take on myself, and would see to it that everybody understands what they have automatically and what they can take advantage of in addition to it. So that's proposal 1. I think $50,000, in my opinion, is a more realistic amount of permanent term coverage. The average individual, if you wanted to keep something more in line with what you already have, proposal 2 would be a more balanced, would be the more of an industry standard snapshot. So we're just shy of 60,000. I rounded it up. Under proposal 2, you'd have $30,000 of term coverage, $30,000 of AD&D, and that would save you at roughly $100 a month in insurance premiums. But it would,
Over what we pay right now.
exactly. Mhm.
So it'd be 640 to 680.
Yeah. Yep. But that would align more with industry standards. You get all the same benefits that I listed above: ability to purchase additional coverage, employee up to $300,000 to $150,000 for spouse, children, so on and so forth. And it's all outlined in the
What
package.
kind of rates can we get for what we're currently paying? Looking at that. 75,000.
Oh, whether or not you're existing,
Yeah, just if we didn't change our rates, you say we're paying 740 to 780 now.
yeah, that's with a company that I can't write for.
Not the company. You said we could get 60,000 for what we're currently paying, or 100 less. So I was thinking, is there, what are you, 70,000 if we don't change what we're paying in? You follow me?
Not exactly.
Well, the rates you say we're paying now for this 57,000 is 740 a month.
Yeah.
And you're saying for 640 a month, we can get 60,000.
Yeah, proportionally, it'd probably come out about 7 on that.
Oh, you're saying if I found something that kept your premium the same?
Yeah.
Yeah, well, the math would be pretty. Yeah, I'd just kind of do the mental math, if there was what would that be? Less than 20% increase in premium, there'd be a corresponding increase. The rate is on the term coverage alone is 16 cents per thousand per employee. The AD&D is fractional, it's like 2 cents. So you're talking less than 20 cents per thousand. So yeah, if you kept your premium the same, then you'd be somewhere between $20,000 and $25,000 of term coverage with AD&D. Did I say that wrong? No, I'm sorry. You'd be somewhere around 32 to 34,000. Yeah, of term and AD&D.
35,000 roughly.
Yeah, and I see from a budget standpoint, that's one less thing to mess around with.
Are there any questions from the audience for Paul?
Especially from the department heads, you were here, so.
They think I'm super pushy. Go ahead.
I need time to think on it.
Yeah.
It'd be nice to have a employee benefits and investment committee that could bounce ideas off and see how they feel and back to the supervisors. The supervisors can make these decisions based upon how we feel our staff feels about things and such. And I'd also recommend whatever policy you guys go with, everybody sign off on it, even if they don't accept it. So employee 10 years from now can't say, well, I was never offered. I mean, I should have offered me what it really was. But I think a committee would be good.
Well,
Yeah, and to your point, even with our employee whole life, I had a stack of papers that were signed by people who said, I understand what's being offered. That's a good thing.
Okay, yeah, we asked the department heads to consider this and bring questions back. I'm not sure we'll implement the committee immediately, but it's an idea. And it's also something that I think is on our agenda in the near future here is to reconsider the whole benefit package. Because there's some things I'm seeing that I'm kind of, where'd that come from? And I think we want to reconsider all this.
Mhm.
We will move that direction.
All right.
I
Sounds
think
great.
that if you can get more policy protection by the same amount of money, and I think it's a no-brainer, for their employees, so.
Yeah, okay.
I agree with you.
Yeah.
That's kind of why I was trying to hit there.
Yeah,
That's what I was picking up.
yeah,
Mhm.
If we can get more coverage for the same amount of money, it's kind of a no deal.
Yeah. Mhm. Yeah, I'll run some exact numbers for you. Okay. Get back to you. Thank you for your time.
thank you, Paul. All right, we are at item number 7 on the agenda, personnel. Request for payroll approval, change of appointment, motor vehicle office. That's in our packet. Any questions or discussion? Yeah, Lori.
That is a vacancy that she's filling, so we looked that up.
Yeah.
So I make a motion to accept.
I'll second the motion. All those in favor indicate by saying aye.
Aye.
Aye, motion is carried. Request for payroll approval, change of employment for the treasurer's office. And this is. Yeah,
Moving her up to take the advancement of the other one.
yes,
I make a motion. to
No.
accept that.
I'll second it. All those in favor of the motion indicate by saying aye. Aye, motion is carried. We are now at number 8, any other business? Why don't we have Tim? Make your comment?
Yeah, the treasurer's investment. report
Oh.
on there.
Yeah. Yeah. Can we do this first or?
I mean, this will only take a second.
Okay, hang on, Tim. The treasurer's investment report, January 23. It's in our packet. We need a motion. Is that correct? And I'll make the motion this time.
I'll second it.
Motion's been made and seconded. All those in favor indicate by saying aye.
Aye.
Aye. Motion is carried. Thank you, Kelly.
You're welcome.
Tim.
I think there's not a limit to motions per meeting, right? Bringing some information this morning. I didn't put this on the agenda. I apologize. I don't really have an action item, although I was hopeful that we would at some point. So this is regarding the emergency medical services and some of the conversations and work that's being done. So I've been an adjunct instructor at the college for a number of years in the emergency medical services program. And if you're familiar with the college all or involved in college all, you know that every academic program has an advisory board that meets twice a year. And those are stakeholders from the industry, giving their input on advice on what direction to take the program. So there are a number of us providers and instructors that advise Josh Heminger, the program lead on EMS. And last fall, our conversation really kind of honed in on a topic that has been kicked around for a while, and that's how do we get people in the pipeline? We're really struggling with that in the profession, as a lot of professions are. But with the high schools partnering with the community colleges and doing a great job with some of the dual enrollment programs and the trade programs. Some of us felt like that's really the key maybe to get some people in the pipeline is to do a high school program. They've done similar things like that in Missouri for years. You could graduate from high school as a certified EMT. So we really wanted to try and pursue that idea and see where that would take us and how we could do that. So we've been working on that for a while. There's been a group of us meeting every week to try and put together what that would look like. There was an opportunity that came about last month through some grant funding through the Future Ready Iowa program that could potentially pay for that. We've been working on that application, and that's a combination of a high school program, but really we call it an internship program. So you don't just enroll in the EMT program, you also go out and do clinical time and then internship time. And then they're paid to do so. So we pay these kids to take the class and we pay for the class. What a great deal. However, it's not that simple. So we've been working on the application that's due actually a week from today. And I thought I would have a proposal for you, but we've hit a couple of snags. And one of those snags is just finding that daytime instructor that can do it. Most of us that teach or have taught traditionally do it at night. Most of us are busy during the day. We can't step away from our full-time jobs to do that. And we don't have the capacity at college. So that's one issue. The original idea was that we were going to ask this board if you would take a leadership role and partner with 3 other counties and do this on a regional basis. So we have representation from Walpole County, Davis County, Athens County, and Van Buren County that wanted to partner to do this. And basically what that would look like is the interns would be then employees of the county and for that summer program. And the program would be a summer program that would begin as soon as school lets out and it gets done basically a week before they go back. So it's a pretty intense deal. And these kids would be paid $12 an hour to go to school, $12 an hour to do their clinical time and their internship time. And then there's other expenses like the course tuition, physicals, immunizations, and those kinds of things. There was a partnership with the WIOA program. If you're familiar with that, and both of these programs are geared toward the at-risk kids, the lower income kids, ones that are in danger of not graduating. We felt maybe there was some opportunity there to grab them and give them an opportunity to pursue a career and help them pay for an internship. So today is just a little bit of information about that work, just to bring you up to speed on kind of some thoughts of that committee, what we've been working on, a proposal that we were hopeful to bring to you. Unless some miracle happens this week and we find an instructor, I will not have a proposal. I at least wanted you to be aware that we were trying to create some options. So any questions?
You don't need anything from us at this point, it's information.
Yep, just your awareness. I wanted you to be, up to speed on what we were thinking and what we could have potentially asked for. But at this point, unfortunately, we have great ideas and great plans, but lack some missing pieces to go forward.
If you had the instructor, what would you be asking for something from us then?
I would. So what that would look like, just to give you an idea. So we would figure out, and I'm still waiting on some information from ICAP to see how that would look like from an insurance standpoint. Our thought was to have 4 students per county. So a cohort of 16 students, ideally. What that would look like from a wage standpoint with wages and Social Security is about $54,565. There are state fees related to certification, which is about $1,280 for those 16 students. And then the tuition for those 16 students is $31,968. So those are kind of so $87,813 are those costs. What we don't have specific costs on are what the physicals would look like, because there's multiple different ways to do that. Immunizations, uniforms, and then things like gas cards and lunches potentially could be paid through the WIOA program. And so those last few things I mentioned could be sourced from another place. And that would be, if we would get that grant, then that would simply mean the county would take on those employees as interns, and then you get reimbursed through the grant if we would win that grant. So you're basically just fronting the money until we get it put back in that account. That's what it would look like. It's kind of a new idea. We wanted to try something. I don't think it's a dead idea. We can't do it this year. Maybe we'll look at it, see what opportunities present themselves in the future, but at least I don't think the work's in vain. I think it's good to do this exercise and put some ideas together and look for opportunities and, you know, ask all the questions. So.
Then it'd be split between the 4 counties too, is that correct? So would you be asking Wapello County?
Well, I would be asking you to be the lead and take that on and then just have the MOUs or 20s between the other counties. So that, and the reason for that is we keep it under one insurance carrier and one employer. It makes it a lot cleaner, that sort of way.
Would you consider doing this under the Regional Planning Commission, which is a 6-county?
I think we would consider any and all options.
Okay.
Yeah, oh, definitely open to that.
Any questions from,
Tim, what would the sustainability of this look like year after year if this were, we got running? I mean, would you have to apply for the grant year after year after year? Or
If
how
it's
would that-
available. So yeah, it just all depends on what funding options are available. You know, the hardest part of anything is to get it started the first time and do proof of concept. And so if it worked well, then we could say, hey, this really works. And then I think you could get really good buy-in from other places that might be willing to fund it. So yeah, and you know, how grants are, they change from moment to moment, it seems like. It's just like the window for this grant was just under 5 weeks, so they don't give you a lot of time. And with most grants, I find you really have to have a shelf ready, well thought out project ready to roll when that grant opportunity appears. And we weren't quite ready for that. We had the concept in mind, but then when you start, you know, it seems simple, but then when you start getting into pieces, it's like, oh, well, what about this? What about this? What about this? And
So you need just one instructor to be able to do this, and is that it?
ideally, you want one, and for continuity, you want one instructor. We've tossed around the ideas of taking pieces. That kind of creates a, I don't know, it's kind of like when you're in school, and if your teacher was absent a lot and you had subs all the time, you know, you just don't have that continuity of instruction, and you don't really, that lowers your quality of instruction. So we try to find that full-time instructor, but you know, one of the conversations we need to have is with the college. I think that's really an opportunity where the college could step up. They used to have 2 full-time instructors during the day, they're down to 1. And the daytime is really tough. You know, evening instructors, we can pull off easier. Because some of us can moonlight, but
what level can you teach up to?
up to the level you're certified at. So I can teach you the advanced level.
Which is EMT or?
So EMT is a step below that. And that's the EMT is the minimum level to do transport.
So you could teach this, you're the instructor.
During the day, that takes me away from my regular job. So that's fine.
We know how that could be arranged.
Congratulations, you've been voluntold.
It's a debate worth having.
It is.
Jeff,
You said $87,000. Is that per student? For
No,
4 students?
that's for all 16.
for the program.
So Wapello County would only be responsible for quarter of that at that current.
Well, no, I want to be the fiscal agent to do it all.
Right, but 28 with 2080, you can get reimbursed for.
Well, the reimbursement would have come from the grant, so they would they would handle the payroll and the tuition payment, and then that reimbursement would come back from the grant back to the county. So we didn't have to do 4 different ones, we just do one.
Right, but if they wanted to still do it without the grant, Wapello County would only be on the hook for a quarter. of
Oh,
it.
I see what you're saying. Mhm.
Yeah,
Not a bad thought.
you have any questions?
All right, thanks for the questions.
And we do want to continue this EMS discussion that we started a couple weeks ago. And I think there is some interest in doing something. We still have the discussion about the ambulance and the relationship with the volunteer fire departments. So we want to continue that discussion, but nothing's been decided, of course, yet, but that is of interest to us. So. All right. I didn't mention this, but I think I have the ability to do this. I've attended the daycare meeting that was last week on Tuesday. And they are planning to do a $2 million renovation to create a daycare. That all sounds good, but then they might be coming back to us for some benefit to them for that. One thing I would like to do, and I'll talk to Kelly or somebody in Kelly's office about this, is kind of do a little survey of the county employees to find out if the county employees are getting daycare needs met, or if that's an issue with the county employees. So you department heads that are here, if you want to kind of get started on that, you could actually do that in your departments, but we can also do it as a group to do some survey work to find out what the need is for daycare. And we want to continue to be supportive of it. I'm not sure we're going to be committed to the project that exists, but we might be asked in the future for some assistance there. So it was a good meeting last Tuesday noon. All right, is there anything else that needs to come before us today?
Motion to adjourn.
I'll second it. All those in favor of adjourning, say aye. Aye. Motion accepted. Meeting is adjourned. Thank you for being here today.